Hi, everyone. My name is Eliot Fishman, and I'm the Senior Director for Health Policy here at Families USA.
And hello, I'm Joe Weissfeld, the Director of Medicaid Initiatives here at Families USA. And the two of us are here today to talk about the Medicaid program and how it intersects with the current COVID crisis that we're dealing with. The Medicaid program is such an interesting program at this time. It's a federal state partnership, and it really needs to be that partnership. And we're in an era where the Medicaid program provides a solution to many of the problems that we are going to be facing and are currently facing. But it also is a program that is full of over 70 million beneficiaries who are really in the crosshairs and just going to struggle and continue to struggle during the foreseeable future. So we really want to talk about opportunities for the Hill to react to this crisis, as well as things that states can and already are doing. So, Eliot, would love to hear on what the Hill has done and what they should be doing to help support the Medicaid program.
Thanks, Joe. And the situation for Medicaid is really kind of a microcosm of the situation in our healthcare system and in our economy. We just found out today another 3 million people filed for unemployment insurance. That brings it to almost 35 million people. At the same time, many of those people will need to rely on Medicaid for coverage. At the same time, the states who fund a significant percentage of the Medicaid program and actually operate the program are facing unprecedented budget shortfalls, both because of a decline in their regular income taxes and sales taxes, and a lot of states are also reliant on gasoline taxes and mining and extraction taxes. I mean, just all of the classic sources of state revenue are down. So that is a very tough position for the Medicaid program and for the tens of millions of people who depend on it. The big thing that Congress did relatively early was to pass a modest increase in the federal matching percentage for Medicaid. And that increase was tied to a requirement that states not cut their Medicaid eligibility, not make cuts to benefits, and not throw people off the program for the term of the public health emergency. So that was an important step. But it is increasingly clear, first of all, that that increase in federal Medicaid funds was really not commensurate with the huge shortfalls that states are facing. A lot of states, despite that increase, are proposing or implementing significant hiring freezes, looking at other packages of Medicaid cuts that are allowed within that requirement, for example, cuts to providers. Meanwhile, the actual providers of care for Medicaid, a lot of them, because people are under lockdown and people are postponing many regular Medicaid procedures, a lot of those providers are hurting too. And state Medicaid agencies, the National Governors Association, American Academy of Family Physicians, a lot of the frontline providers and the agencies that fund them are now crying out for additional support, both directly to states and to give states the flexibility to make those funds available to providers. So that is the context for very urgent requests that we are making in Congress, both for additional federal Medicaid matching funds and for more flexibility to Medicaid agencies with 100% federal support to cover uninsured people now in Medicaid. And maybe, Joe, you could speak about, in terms of covering the uninsured, what specific kinds of things we're thinking about.
Yeah, absolutely. And I think it's helpful to have that federal context because states have so many flexibilities already, and they're exploring many of those flexibilities. But those big budget shortfalls that state fiscal relief that really only the federal government can do needs to happen, and it needs to happen fairly quickly. But while they're waiting for that, the states really have been acting as much as they can. And one of those things that they've been doing and exploring is the uninsured option that came out of federal legislation that allows uh, COVID testing to be covered at 100% FMAP for anyone who's uninsured. And that really gives states the ability to ensure uh, anyone who needs it can get tested. But that treatment piece really is a big outlier in that overall uh, set of offerings.
So, Joe, you mentioned the flexibilities that states have under Medicaid, and we've been talking a lot about potential statutory changes, but states are both in actions that have already been federally approved, and in a lot of state proposals, states are trying to max out on what they can do in the absence of federal legislative changes. Could you speak to that?
So there are a number of existing authorities that states can leverage. These include disaster spas, which are temporary spas that allow states to pursue a number of different options.
And SPAS
One,
is a state plan amendment.
yeah, the state plan amendments that are temporary. We have 28 states that have done approvals for that for both their regular Medicaid population or their children's health insurance program. We also have every state has gotten an 1135 waiver. Those waivers really allow additional provider flexibilities to enroll more providers into the Medicaid program. Uh, the states jumped on that. All 50 states and DC have gotten one of those. We also have 1115 waivers that can be temporary, and one state, Washington, has gotten that. So what we've seen through these temporary pieces are a lot of uh, uh, covering the uninsured, waiving cost sharing, and making it easier to get and keep the Medicaid coverage during this crisis. And I think that's really important. A lot of these pieces are also available on a permanent basis, and would be quite helpful to many states if they did pursue these on a permanent basis so that there's not a cliff at the end of the public health emergency.
And anyone who wants details on those things that both states have proposed and things that have been approved, Joe and I and a couple of colleagues did a webinar on this that's right up on the Families USA webpage. If you go to the resources page on our webpage, that webinar is, I think, one of the resources right up front. The Medicaid program is already playing a very important role, but the states who operate that Medicaid program are really hurting, and really, for all of us and for all of our safety, need a lot of federal support. I'll just close with one anecdote that was very striking to me, which is Minnesota is, like many states, trying to stand up a significant new public health response to help move past lockdowns, which involves hiring a lot of people to trace everyone who has been in contact with somebody who screens positive for COVID-19. And Minnesota's public health director said that they're not able to hire contact tracers because they have a hiring freeze because of a state budget crisis. So it just shows the interactions between moving past lockdown, getting past the economic crisis, and having sufficient support to states to do their job in testing and tracking people with COVID-19. So really, the cornerstone of any effort to get out of the situation that we're in, and to do so safely, winds up being Medicaid funding for states. I am Eliot Fishman.
And I'm Joe Weissfeld.
Thank you very much.